Hello and welcome to 5 Minute Pharmacology. Today we're going to be talking about the drug Naloxone. Naloxone's trade name is Narcan. Its classification is a narcotic opioid antagonist and it is carried at 2 milligrams and 2 mLs, and we carry 5 mini Bristol-jets of this medication in our drug boxes. Some pharmacology and actions behind Narcan and how it works. It is a narcotic antagonist which competitively binds to opioid receptors in the brain. If you want to equate that to a child protection cover on an outlet that binds to the outlet and it doesn't allow, let's say, a fan to plug into that outlet, is so quote unquote how Narcan would work to bind to the receptors to not allow a substance like an opioid agonist like morphine or fentanyl or heroin bind to those same receptor sites. So it basically displaces opioid molecules, reversing the effects of opioids on the brain. So its indications is reversal of acute opioid toxicity. The only contraindication is an allergy to the medication, and some precautions and side effects to go over. It may precipitate acute withdrawal symptoms in patients who chronically use opioids, so it's always best to start out with judicious smaller doses of this and then build up. You may see agitation, tachycardia, pulmonary edema, nausea, vomiting, and seizures in the neonate population. Be prepared to restrain the patient as they may become violent or with the reverse effects of the narcotic. The duration of some narcotics is longer than naloxone, so just keep in mind that Narcan may wear off in about 20 minutes, so you may need repeat doses of this. So it's good to think about. Um, when given IV, the onset is less than 2 minutes. When given IM or intranasal, it's 2 to 10 minutes. Its peak effect when given IV is less than 2 minutes, and when given IM or intranasal is 2 to 10 minutes. And then the duration is about 20 minutes to 120 minutes, no matter which way you give it. Um, so with these patients, with altered mental status, we want to make sure it's a good drug to kind of rule out a potential opiate overdose when you're unsure. But with any patient with an altered mental status, we want to kind of rule out some other things as well. Just don't forget to check the glucose. Is the patient maybe potentially septic, stroke? Did they have a seizure? Are they in shock type states? All those things as well. Narcan is a good drug, though, to give if you are really unsure and you're kind of at a dead end, or maybe you're suspecting an opiate overdose. Um, the dose for that is zero point 0.4 to 2 milligrams. You can give this IV, IM, or IN, and you can repeat it as needed. But having said that, I hope you learned something about Narcan. Thank you for listening.